I am Dr. Mangala Bharati, Professor and Head, Department of Neonatology at IOG, Institute of Obstetrics and Gynecology, the Hospital for Women and Children, Madras Medical College, Egmore, Chennai. I'll take this opportunity to first convey our thanks to our donors, the Agilysys organization, and more so to our partners in healthcare, the NGO, Ekam. We have received a wonderful, a very important life-saving equipment. So this is called as a high-frequency ventilator, and which costs around 30 lakhs is the cost of this machine. We all know that when newborn babies get sick, so they won't be able to breathe comfortably on their own. So they have to be put on assisted some support to take care of their breathing. Though there are various machines available like CPAP systems and other kinds of ventilators. So these machines are capable of supporting only if the lung is somewhat in a mild to moderate kind of disease. When the disease is very severe, even conventional ventilators are not enough and they are not capable of supporting the breathing of these babies. So we require an advanced form of ventilation called as an high frequency ventilation. So for quite some time, there was a big need felt about the need for this high-end machine, a high frequency ventilator in our hospital. So on one hand, actually we were moving the government to I think soon that I'm happy to say that actually we will be receiving more high frequency ventilators through the government as well recently, that had been sanctioned through the government also. So in the meantime, so we are exploring other options of getting these machines. So we approached Ekam because we know that Ekam is in touch, and they are the right kind of people who know where are the resources, and it's very I'll say next to impossible for us to individually know who are the people who are interested in donating equipment or whatever it is. So they are the nodal point. So they have helped us a lot in the past as well. So we took this route, and we asked Ekam whether they could help us in finding somebody who can donate us a high frequency ventilator. So again, we're very glad that after some time, I think after their extensive searches and their pushes and a lot of I know it's not going to be easy. They would have approached a lot of people with this proposal. They were able to find a good donor. Again, we're very happy that Agilysys has stepped in to support this equipment to our ICU. So even after finding the donor, obviously next it comes to the quality of the equipment, what we are going to buy. So we had to follow a thorough proper process also for purchasing the equipment. Even though it comes through a donation, obviously a fair practice has to be there, and so we gave technical specifications which was needed for our needs, and then actually the quotations were floated, like to equipments which met the technical specifications were shortlisted, and again Ekam handled us in this process. They helped us in getting quotations from important vendors as well. Again, there was a technical committee which went through these various specifications and quotations, both financial quotes as well as technical quotes. So the technical committee went through this, and then when we shortlisted which we felt is the best option both financially as well as technically when we talk about this high frequency ventilator. And it is not just only about the equipment. So being in public sector, we know that actually especially when it comes through a donation, so it is not easy to again find resources for a continued support to this machine in terms of later service and replacements of parts when things go wrong. It's not that only things need to go wrong. Obviously any machine will require continued support. Some service equipments will be required, some wear and tear will be there in the machine, more so in a public health setting where there will be a high utility of this machine, where this machine will be running for continuously for a longer time compared to private health settings. So one thing that we wanted to make sure was that, okay, most of the time, the equipment manufacturers provide only a standard 1 year warranty to cover the various parts of the equipment. And from then onwards, it has to be an annual maintenance contract, which is something they might give a quote for how much money will be required annually, but they don't include that in the cost of the machine. So we mandated we thought for a government health setting, at least all the components and including the service has to be covered for a minimum period of 3 years. So we negotiated with the company in the given budget for a 3 years of extended warranty and a comprehensive maintenance contract, which will cover all aspects of the machine. And I'll say we were able to strike a good deal with the company in the given resources for an extended warranty and CMC for a period of 3 years for this machine. And so once things were done, I think obviously Ekam helped us. The donor had placed the order, and then within a specified time frame, the machine was supplied. And I think we're very happy that once the machine was put into use, again the donors visited us, and so they ensured that the machine is really useful to the babies and is being made use of in the real world. And we are very happy to actually share the data in terms of like the number of patients for which this machine is being useful. Actually, that means the number of lives that are being saved by this equipment. So periodic statistics, especially at least at a 6-monthly or at an annual level. So what has been the real impact of this equipment in terms of changing the lives of that babies? So that kind of feedback we have been providing that both to Ekam and also to the donor when it comes to this equipment. So that's the story of this ventilator, high frequency ventilator. For more than a year now, this equipment is helping us in a big way in saving the lives of these small ones, and excellent service and maintenance being provided by the supplier also. So we want to just, I think, showcase this as a model, and we look forward to more and more people through their CSR or their philanthropic activities to come forward and support the needy. And of course, Ekam is always there to bridge us together and help us understand each other what is needed from the other end. And let's all together work towards saving more and more small and sick babies. Thank you.